we get started, we're just going to go over some vitals that our medical assistant has gotten before we proceed with our exam. So our temperature was 36.7 Celsius, our heart rate was 76, our blood pressure was 127/72, our respiratory rate was 18, and our oxygen saturation is 98% on room air. Our patient here is 6 feet tall and 155 pounds. So we'll move forward with the rest of our exam. All right, good morning. My name is Heidi. I'm a nurse practitioner student and I'm going to be completing your assessment today. Is that okay if we get started?
Yeah.
Awesome. I'm going to provide privacy for my patient. I'm going to do some hand hygiene and then we'll get started, okay? Tell me what brings you in today. What did you come to have done?
Just my yearly checkup.
Yearly checkup, okay? Wonderful. And so we'll start with an overview, just looking overall. I see a well-appearing, well-dressed, well-groomed male in his early 20s. I don't see any obvious signs of distress or discoloration or anything concerning right off the bat. So we'll go ahead and get going with the next part of our exam. We will assess orientation. So can you tell me what the day is today?
January 31st, 2025.
Awesome. And where did you come in to have this done today?
The clinic.
Wonderful. So A&O times 4. And can you tell me your name?
Kyler Childs.
Perfect. Right, next, we'll start with the head and face. So I'm going to inspect. I'm going to part the hair in several parts. I don't see any obvious deformities or any part that is asymmetrical. So that is good. I don't feel any abnormalities of the scalp or see any abnormalities of the scalp. Next, moving on to the face. Face looks symmetrical. We are going to test some cranial nerves by testing your facial expressions. So can you raise your eyebrows for me? And can you clench your teeth? Can you puff out your cheeks? Awesome. Can you wrinkle your forehead? Perfect. And can you stick out your tongue? Perfect. Okay. Moving on to touch, I'm going to have you close your eyes and you tell me whether this is soft or sharp, okay?
Soft.
Okay.
Sharp. 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 Soft.
Okay. He appears to have intact perception on all parts of his face. Next, we are going to move on to the skull and the sinuses. So we are going to palpate the entire head. I don't appreciate any obvious abnormalities or bumps or step-offs. We are going to palpate the sinuses. No obvious abnormalities there. Moving on, we're going to move to the eyes. We're going to test visual fields by having you follow my finger with your eyes. So keeping your head still and just moving your eyes. Wonderful. Perfect. We're going to use our ophthalmoscope to assess for red reflex. If you can cover one eye for me. Awesome. And I see a nice red reflex, other eye. a reflex. I don't notice any opacities. Moving onward, we are going to look with a pen light to assess your pupils. His pupils are equal, round, and reactive to light. I notice the anatomy of his eye, his pupils, his iris, his conjunctiva. I don't notice any redness or swelling or abnormalities with his eyes. Next, we are going to use the Snellen chart we have here to assess visual acuity. So if you could cover one eye and read the first 3 rows.
ELTFPH.
Perfect. And then if you can cover the other eye and read the last row.
LTFPH.
Awesome. So he appears to have 20/20 vision. Moving on, we are going to move down to the ears. So first I'm just inspecting. I notice that they are symmetrical, no obvious blockage of the auditory canal. I will next move on to the otoscope to look inside of the ears. So I'm just going to use the otoscope to look inside of the ears. No obvious blockages of the auditory canal on that side. And his tympanic membranes look gray and pearly without any redness or inflammation. I don't appreciate any fluid behind the ears. So his ears look healthy today. Moving on, we are going to palpate the lymph nodes. Do you have any tenderness?
No.
And next we're going to move on to our hearing test. So I'm going to do what's called a whisper test. Cover your right ear with your hand. Perfect. And then just repeat what you hear.
24. 99.
And then cover your other ear. 37.
37.
42.
42.
Perfect. So his hearing appears to be intact from that test. Next, we're going to use our tuning fork to assess for bone conduction in hearing. Tell me if you hear on both sides or just one.
Both.
Wonderful. And then tell me what is louder, A or B? A or B?
B.
And one more time. A or B?
B.
Perfect. Next, we are going to move on to the nose. I see his nose is symmetrical with no obvious lesions. When I look, I don't see any obstructions of his nares. Go ahead and cover one nostril and breathe in and out for me. And then switch to the other side, breathe in and out. He appears to have 2 patent nostrils with no blockages. I'm going to take my light and visually look as well. Again, I don't see any obstruction of his nares. Next we'll move on to a smell test. Tell me what you can smell.
Alcohol.
An alcohol swab. So his smell appears to be intact from our limited assessment here. Moving on to the mouth, I see that his lips are pink and elastic. I don't see any obvious injury or lesions to them. I'm going to use my light to look at the buccal mucosa. If you can open your mouth. All his teeth look intact. I don't see any broken, missing parts. And then if you can say ah.
Ah.
Say ah again.
Ah.
His uvula appears midline. His tonsils are grade 1. I don't appreciate any swelling or exudate on the tonsils. Moving on to the neck. I see that his neck is symmetrical. I don't appreciate any lumps or asymmetry or bumps. We're going to look for the thyroid. So it looks symmetrical at rest, and then if you can look up and swallow, also appears symmetrical with swallowing. we are going to assess for jugular venous distension. So we'll have you look this way. I don't notice any jugular venous distension, and then look to your right. I also don't notice it on this side at all. I'm going to listen with my stethoscope to his carotids. I do not hear any bruits. I'm going to palpate, feel the thyroid. Do you have any tenderness when I do this?
No.
Wonderful. We are going to look at range of motion. You can look up and down and to your left and to your right. His range of motion appears to be intact. Next, we will have you take your shirt off for this part. We're going to look at our chest and abdomen exam. Perfect. So first, just inspecting the chest. His chest appears to be symmetrical. His shoulders are symmetrical. I'm going to walk around and appreciate the both anterior, posterior, and lateral diameter. I don't appreciate any barrel chest. So he looks like everything's within normal limits right now. Next, we're going to palpate for tactile fremitus. So I'm going to come behind you, and I'm just going to have you say the words 99.
99.
And again.
99.
And again.
99.
I do not appreciate any tactile fremitus. Moving on, we are going to percuss all of our lung fields. And front. I don't appreciate any areas of dullness based on percussion. Next, we're going to listen to all the lung fields, both anterior and posterior, and just take a deep breath in. Good, and from the back, another deep breath. Good. Wonderful. I appreciate vesicular breath sounds in all the lung fields. They are clear and equal. I don't appreciate any agophony. Next, we are going to move on to the heart. First, we are going to inspect, and everything appears symmetrical. I don't appreciate any abnormalities on visual inspection. Next, we will palpate the precordium. We are next going to auscultate in the 5 locations for all 5 points of auscultation. So first, using the diaphragm, we are going to listen for aortic, pulmonic, Erb's point, mitral, and tricuspid. This is also the point of maximum impulse, the mid-clavicular line 5th intercostal space. I appreciate S1, S2 heart sounds, no murmurs, no 3rd or 4th heart sounds. We are then going to listen with the bell in each of those same locations. Perfect. Next, we're going to move on to the abdomen. Let's have you lie down. scaphoid abdomen, no rounded or tight abdomen. We are next going to auscultate vowel sounds in all 4 quadrants. I hear active vowel sounds in all 4 quadrants. We are also going to listen for his aorta. And next we are going to palpate for any tenderness. Does it hurt anywhere that I'm pushing? No rebound tenderness, so we don't really have concern for appendicitis. Negative Murphy sign. I don't appreciate any enlargement of the liver or any enlargement of the spleen. Moving on, we don't appreciate any ascites or don't have suspicion based on this abdominal exam for cholecystitis. We will have you go ahead and sit up now. We're going to move on to our upper extremities. So just looking, I don't appreciate any abnormalities. Hands and arms are symmetrical. They are normal color. There's no lesions or discoloration. We'll move on to our palpation. I'm going to palpate for a brachial pulse and radial pulse. Both of his upper extremities are warm, well perfused. He has a cap refill of 3 seconds and his skin is elastic. Next we'll do range of motion. If you can put your hands like this and move out and in and flip top to bottom, up and down. And if you can pull my hands toward you and then push away. Good. And if you can put the backs of your hands together, this is to assess for carpal tunnel, the Fallon test. So no concerns for carpal tunnel at this time. Moving on, we are going to move down to his legs. I see that they are symmetrical, even hair distribution, no varicose veins, and no signs of venous insufficiency. We are going to do range of motions with your legs as well. Can you lift your knee and flip up and down? And other side. Good. We're going to have you lie down. Turn on your left side. There you go. And then just swing your leg forward and back. Good. And then lay on your back and bend this knee up. He appears to have good normal range of motion. I don't hear any clicks or any signs of hip dysplasia or anything like that. Let's do the other side as well. You can just lay on that side and then swing. Okay, and then sit up. Good range of motion with his legs. Lastly, we're going to do a bit more of our neuro exam. We will do, can you do your finger to your nose and away, and finger to my finger, and finger back to your nose, finger to my finger back to your nose. Good. Next, we are going to assess all over for sensation. So you can shut your eyes and tell me whether you feel soft or sharp.
Soft. Sharp. Sharp. Soft. Soft. Sharp. Soft. Soft.
Okay, so a perception appears to be intact. Next, we are going to test some reflexes. So,
Ready.
no, just relax. And then scoot your legs back so they're hanging. And next we will appreciate pulses. So we are going to do brachial, radial, we will just verbalize the femoral pulse, and then popliteal and dorsalis pedis. Next we're going to have you stand up right here and then just walk across the room in a straight line, heel to toe. Perfect. And then can you walk on your tiptoes back that way? And then walk on your heels toward me. And then our final assessment will just be a Romberg test. So if you can just stand with your hands to your side and then close your eyes. Wonderful. So he's able to